Okay, we are now streaming live, so I guess whenever Janine and you are ready, Mike, you guys can go ahead.
Okay. Janine, you there?
Hi, Mike. Yeah, I'm here. How are you?
Good. We all set?
I believe so. I do see Pernell is here. Nan is here. So
Puma's on his way in now, and Sunny.
Okay. Well, we'll get started if they're on their way in. Welcome, ladies and gentlemen. This is Tuesday, March 16th, the day before the day here in Cuyahoga County. If we could, please have a roll call.
calling the roll, Mr. Gallagher,
Here.
Ms. Comwell,
Present.
Mr. Tuma,
Here.
Mr. Jones. I do see that Mr. Jones is connected. Ms. Simon.
Yep, here. Thank you.
Oh, I'm here.
Okay, thank you. There is a quorum. Also like the record to reflect that Councilman Miller is in attendance.
Welcome, Mr. Miller.
And Nan
Thank
Baker.
you.
Oh, and I apologize, and Ms. Baker.
And Nan. Do we have public comment?
No, Mr. Chair, no one submitted any public comment.
In your package, you received the minutes of our March 2nd meeting. If they're in order, I'll accept a motion and a second.
I'll make that motion.
Second, Simon.
Motion and second. Any discussion on that? All in favor?
Aye.
Aye. Against?
Raise hands down.
If you're not speaking, please mute. There are no matters referred to committee, and we set this time aside a couple weeks ago for an update on the COVID-19 distribution. As we've been watching and hearing in the media and through updates from the state of Ohio and city of Cleveland and others, we're well on our way to vaccinating a good portion of the population. But we wanted to give Terry Allen an opportunity to speak with us and to answer any questions that we may have. Terry, are you available?
Yes, Mr. Chairman and members of council, thank you for the opportunity to talk with you. There's some background noise here. I'm actually out at Wolstein. And so I apologize, in a very large room with several things happening. So I apologize. I hope this is okay and I'm able to talk over the background noise. I'd like to, Ashley, is it okay if I share my screen at this time?
Yes.
Thank you. Okay. Is everyone able to see the slide set?
Yes.
Very good. Thank you. Okay. Thank you for the opportunity to come back. And I know I spoke with you not too long ago with some friends from the hospital systems to give you an update on where we're headed here. And so we'll kind of take you where we're at. Things are moving very quickly, as you know, even as recent as this morning with the recent governor's announcement. We'll talk about that too. So I'll review the epidemiology, basically the case investigation, contact tracing work, and our data tracking. A lot of community coordination that's happening in this response, and even more so at the moment. When I made these slides, we had phase A, 1 through 1D and 2B, but of course, we know at the end of the month, the lid will be off at the end of March in terms of opportunity for vaccination. We'll talk about that. Also, some specific equity considerations that are very much part of the work here, the work we've been doing at the Board of Health, the work happening here at Wolstein, and also work happening with community partners. So I'll proceed here. So here's our current numbers in Cuyahoga County. We're now about almost 98,500 cases to date, over 6,000 hospitalizations, and 1,920 deaths. And glad to see that recovery there. Those are estimated recoveries, usually estimated about a month after the case reports. I would also say that statewide, we're looking at almost knocking on the door of 1 million cases, 18,000 fatalities nationally, 535,000 people have died. So just taking a moment to recognize the tragedy that this pandemic has been and continues to be for people, job losses, lots of heartache for families, and recognizing the great difficulties that we've dealt with so far and have lived through together. So here's our epi curve, our epidemiologic curve, and you'll see from the very beginning. I remember actually March 9th when the first cases were reported in the state. Here in Cuyahoga County, we had 2 cases that were reported, and then subsequently we found out there were cases actually that occurred even earlier before that date that were recognized. And of course, we had those early cases. Seemed like things were very busy in last March, and then of course we had the summer surge that happened in mid-June to mid-July. Followed by the mask mandate, which was incredibly effective at reducing cases, as we'll see here in September and October. But then, of course, we had this major surge that happened into September that then came down as we've come down from this mountain of cases into basically a plateau. And we'll talk about where we sit now, but have plateaued at a level right now, but we're way down from where we were. So lots of positive things happening, lots of seniors protected from vaccination and reduced hospitalizations and reduced fatalities as a result. So lots of momentum building at the moment. If we sort of zoom in and we look at our trend since January 1st, you have I think a clearer picture of basically that trend that happened through the winter. Interestingly enough, this is not just a local but a national and an international phenomenon, is that we haven't seen any flu, and that's because we've distanced. People are working remotely, people are masking, and people are staying home when they're sick. And so there's some lessons to be learned about how we snuffed out flu in the context of our response to COVID. But if you look where we're at now, we're running actually countywide around 200 cases a day we're seeing between us and the city of Cleveland together. And we're kind of somewhere in that area when we saw the summer surge, just to provide some context. So we've made great progress. We're vaccinating at higher rates than we ever have before, but we still have much work to do to basically hold the line here to make sure that we get through this and we continue to put shots in arms. So we'll talk about that in a bit. So what you're looking at here is the public health advisory system from the state. And the last report from the state shows that we were at 190 cases per 100,000 people in Cuyahoga County. And so we look at rates because it's the best way to compare populations of different sizes. We have a population of 1.2 million here. If we go to Geauga, it's around 93,000. 100 cases in Cuyahoga, as an example, would be about 8 cases per 100,000. In Geauga, it would be 107 cases per 100,000. So it gives you a sense of the burden of disease relative to population. The governor has said that when we statewide are at 50 cases per 100,000, that he would remove the state orders that are currently in place. And so we currently have a masking order in place that's really helped also to prevent cases. And we'll be watching this as we go forward to understand how we proceed toward this date. So we're looking at here is hospital utilization data, and this is actually a very interesting slide. You'll see in the blue are the adult medical beds. You'll see in the orange line are the pediatric medical beds. You'll see in the gray line, those are the critical care beds or ICU beds, and then ventilator use is in yellow. And so an interesting phenomenon has occurred is that it looks as if these numbers, these lines are fairly stable and straight, but what we've seen is basically a flip. There are about 2% to 4% of the cases in hospitals now are COVID related. These are patients that had delayed care that are now in the hospital for other purposes. So we've seen some stability in these numbers. We're coming down from critical care beds and vent use. But we're down from where we were early on with vent use, that peak that we saw when this began initially, and all those tragedies in nursing homes and all the fatalities. I remember some very, very hard days early on when we were just learning about this situation and all the fatalities that we were dealing with in real time. It was something I'll never forget. So that's the situation we're in right now. We work, of course, very closely with our hospitals, with EMS, with our school systems, with a range of partners to stay in touch on a regular basis. And cooperation has been incredible. So let's talk about testing. So if you look at what's happened with testing in the communities, we track testing weekly across all the hospital systems. And if we talk about our peak, at our peak, we were about 26% of those tested were positive, and we were testing about 44,000 people a week. So several things have happened. We've seen that rate drop precipitously. We're now about 4.8% of people positive, but we also seeing a less than half of that 44,000 people tested. So we're testing less people, we're seeing less interest in testing. And so we need to do everything we can to continue to test so that we have good situational awareness on basically where the pandemic is headed. But the numbers are dropping, and that's good. Also, we've seen the numbers drop significantly in nursing homes from the data we get from the feds, down from 16% at its high, and it continues to drop to 8.9% in nursing homes. We know that between 75 and 80% of residents in nursing homes have been vaccinated, and we're starting to see more of the staff get vaccinated. That number had been at 40%. And so we want to continue to offer it in lots of different places so that people can get access to it when they're ready to get vaccinated. So there's lots of coordination, as I mentioned, with our hospital systems, with our community health centers, across health departments in the region, in the state health department, and the CDC, a range of support services from the social services here among the county agencies. And we've been meeting weekly, and that's been a wonderful experience to team up to try to help vulnerable populations. Our EMS, coming from a family of firemen, EMS cooperation has been great, supporting them and their response, and they're vaccinating in our clinics, which we're very, very appreciative of. Our schools are going back either hybrid or full face-to-face, and those staff have been vaccinated. About 23,000 people are working in schools are about finishing up their vaccinations. All of you and our faith community health workers, we've been working very closely with on our community clinics and outreach in places like Stevie's Cleveland, Garfield Heights, in Warrensville Heights, a whole range of efforts. And even now with the Wolstein, we'll talk about that shortly. And of course, academia and looking at the research and the evidence. So we're going to move quickly through these because this is sort of old news, given how quickly things are moving. But we're really in phase one was limited supply. Phase two is this supply increasing. And I think we're sort of in that stage now, and we'll be moving as we move into the later spring into a widely available vaccine to where most of us have access if we'd like it. We went through phase 1A. These were our healthcare workers and people in vet homes, EMS responders, those who were developmentally disabled. And we expanded to B, people 65 years and older, people with certain health conditions, as well as adults working in schools. Moved on to 1C, where we worked at pregnant women, bone marrow transplant recipients, people with Lou Gehrig's disease, and child care center workers, law enforcement, and those in funeral services. And on to 1D very recently, and that's people with type 2 diabetes and end-stage renal disease were included. And again, very quickly, we're seeing these changes to phases rapidly evolve. And we're at 2B, where we were just as of today. Earlier this morning, we were at 50 and older for access. And just this morning, many of you have heard that the governor announced that we will be going to, at the end of this week, to 40 and above, plus additional 5 health conditions that he'll be describing will be included. But that by the end of March, or March 29th, I think actually is the date, we will have open access to those 16 and above for Pfizer access, and 18 and above for Pfizer or Moderna, and the J&J. And so we will see that access change very quickly here. I know that certainly the President Biden, has said he wanted by May 1st that everyone would have access. So this allows the supply to be made more widely available and takes full advantage of the ramp up of vaccines across the community. So our approach, we have these 80 locations, pharmacies, hospitals, health departments, community health centers, and they've been increasing and will continue to increase into the end of March and into February. We've been doing large points of dispensing or pods every week, east and west, as well as our community pods in places like the Salvation Army, working with the National Guard at senior buildings in Garfield Heights and East Cleveland. We will continue to focus on doing both these large pods and these community pods so people can get access close to home if they prefer. Mobile teams going into recovery houses, those who are developmentally disabled, a range of efforts to ensure equitable access are underway in the community. Hospitals are expanding their focus now and are ramping up as more vaccine becomes available to expand the number of people that they can reach through the phases. Our federally qualified health centers are doing pop-ups associated with in their clinics, but also in neighborhoods with churches and others. We mentioned schools and pharmacies handling a lot of overflow of patients. And people are finding it's easier to get vaccine now, which is also very positive. I mentioned the senior housing and lots of assistance from your resources you provided for 211 in coordination with the county executive. Senior Adult Services, Senior Centers, Libraries, Western Reserve Area Agency on Aging. Lots of people. The foundations are also beginning to assist and are going to be supporting funding some hubs to assist with vaccine, making a vaccine available to people and directing folks in the neighborhoods to get access as they're ready to be vaccinated.
Mr. Chair, I have a question on that point. Is that okay?
Yeah, go ahead, but after this, let's let Terry finish and then we'll have the questions answered. Go ahead, ma'am.
Okay, through the chair to Director Allen, in your strategy of approach, who is responsible for keeping all this data of all these shots at all these different agencies? Are you coordinating that?
Thank you for your question, Councilwoman Kamal. All of the data is entered either through an electronic health record to the state or directly into a system called Impact that goes to the state health department. So on any vaccination, whether it's mumps, measles, rubella, or flu, any vaccination is entered through the Impact system. And so the state is then able to tabulate all vaccination rates, which are on the state website. There's actually a vaccine dashboard that shows the data. And I'll show you a little bit about that in just a moment, some of the data from the dashboard on where we stand as of yesterday.
Okay, go ahead, Terry.
Thank you. So we all know about this site, and I'm actually sitting, as I mentioned, here now and getting a soft opening. Tomorrow will be is a soft opening today, and they did some dry runs. They're vaccinating people in their seats as they come in. There's probably about 500 seats on the floor, 6 feet apart on all sides. It's pretty impressive with lots of active military and National Guard here, and lots of people signing up through the system to get access. And we'll talk a little bit later on the equity front because they're setting aside appointments to ensure that folks, that they're reserving appointments so that folks in the neighborhoods can get access. And I think that's an important piece that we're all working hard to facilitate. You can get access to our waiting list. We actually have about 55,000 people on our waiting list, and the state is using that waiting list to also help sign people up. They're separating the data by zip codes to make sure that we meet the equity goals, as well as helping us to reduce that volume so that we can move through our waiting list quicker. They're also through the Cobb County website. There's a link that provides some maps of the locations. And right now, 72% of us are within a mile of a provider in Cuyahoga County. And so as more vaccine becomes available, folks can choose to go to varying places to get access. And we think that's a great thing, not unlike how flu is disseminated in the county. Also through the state, we have the link of coronavirus. And this is a link that's recently been replaced by this get the shot coronavirus.ohio.gov. And so this is where people are going now to sign up and for Wolstein and many sites around the community. So here's our vaccine data that Councilman Kamal was asking about. So this is data from just yesterday. So you'll see about almost 20% of us have gotten our first dose in the county. And that's about 242,000 people, almost 243,000 people. That's about even with the state overall. And you can see the age ranges. Lots of seniors are protected. If you look at 65 and above, we're still working through that across the county. This is about 80 providers that have been providing vaccine. And so you'll see we're working on those older age ranges because that's where the risk exists. Actually, 50 and above is where 95%, 96% of the risk exists with hospitalizations and fatalities. And so we're watching that very closely, these numbers as they change. We're going to talk a little bit about where we stand relative to equity right now. So if you look, you'll see about 22% of females have been vaccinated and 15% of males of the population vaccinated. You will see that across a race, 22% of the white population has been vaccinated. About 9%, and that number has been climbing, of the African-American population has been vaccinated, closing in on 17% of the Asian population. And you'll see American, Indian, Alaska Native, and Native Hawaiian, Pacific Islander, and multiracial as well listed there. And then among non-Hispanic Latino, 15%, almost 16%, non-Hispanic Latino, and interestingly, still 51%, 51,000 people are not filling out that ethnicity, which is difficult for us to then be able to tabulate the data, and about 8% Hispanic Latino. These numbers are beginning to improve. There's been a tremendous amount of outreach in the community. There was some initial concerns we had from some faith leaders about hesitancy, but as faith leaders are becoming vaccinated and people are hearing more about friends and relatives that have had a positive experience for the vaccination, we're seeing increased interest in vaccination, and some of the hesitancy has reduced. And we are working again with a range of nonprofits, the community health centers, the foundations, lots of the together to try and to increase vaccination for to create equitable access across communities of color, and that's an important imperative that's been emphasized here at the Wolstein. We talk about this relative to race and ethnicity and gender, and as well as LGBT communities and immigrant populations and refugees and people who are disabled, folks in recovery houses, a range of populations we want to reach to assure that we're providing access. And that means that you got to do it on the weekends, you do it in the evenings, you provide easy access to the facility, you work with trusted partners. And we've been partnering with places like Global Cleveland and others to help us gain that access. So what's happening at the Wolstein right now, there are efforts underway coordinated through the state of Ohio with many partners locally where there are access being provided specifically reservations to reach communities of color and other vulnerable populations. And lots of effort is going in to sign them up and then to work on transportation. We know, that you, of course, working with the county executive, have provided resources to support RTA and 211 and efforts to support transportation options for people to get down here. We think that's great. I watched the process. It's incredibly smooth down here. They have lots and lots of staff that are well orchestrated and trained to deliver. So you'll have lots of choices. People can come here to take full advantage of the vaccine that they have available. And we'll also have community choices and mobile locations and community clinics that will continue to happen associated with churches and a range of other nonprofit groups to continue to get as many people vaccinated as we can so that we can get past this pandemic. The thing we're watching very closely are these variant strains. In UK strain, we've seen that emerge in Ohio. So we know that this UK strain B117 is here. And we know that by the end of March, it's expected to be the predominant strain in the United States. It's easily transmissible. There's a strain that we're seeing also from South Africa, from Brazil, and some other variant strains here in the United States, that this is the way viruses work. They constantly mutate, they shift, they drift. And so the idea is to vaccinate as many of us as possible, as quickly as possible. So this is why we need to continue to mask. We need to continue to distance. And we need to continue to avoid large gatherings to the degree possible so that we can drive down that rate to 50 cases per 100,000 in the state and get us back to the normalcy that we all would very much like to see. So our road to recovery, as we think ahead, what does that transition look like for the county, for the state, for our community, as we begin to transition businesses and others back following the guidelines, and how does that affect how we look at the world now? Because I think it's important to recognize that preparedness is critical, that capabilities from IT to infrastructure are critical pieces to have in place for the next time something like this happens. We need to be prepared and think about what that transition looks like, and also understand that a lot of people went through a lot in this process. And there's been a lot of heartbreak, frankly, conversations I've had with people that I'll never forget during contact tracing, people that lost their wife and they were sitting in isolation at home, sick and alone and grieving their family members. Lots of pain and lots of heartache, and lots of incredibly heroic moments where people were working, our staff and others that I've worked with, that just gave everything they had and more to try to get through and plow through this response. Been doing this for 33 years and been through 5 different major emergency responses, and nothing compares to this one. So I just want to appreciate our staff, the people that I have worked with and have great respect for. They are warriors. I would not describe them any other way. 7 days a week for the last year. Our hospital and community health partners, the development and disabled Adams boards, the school districts, social service partners at the county, EMS, our volunteers, community emergency response teams in communities around this county have been incredible. Our EMS vaccinators, incredible. They keep showing up. our medical reserve corps nurses that keep showing up, our volunteers, county emergency management, and all kinds of partner communities, all of our cities, villages, and townships. And of course, your support has been critical. So here's just a picture of our staff when we got accredited in 2019. No masks, better times. We'll get back there. And I just that's all I have for you today. And I'm happy to answer questions on anything you have. But we're moving in the right direction. We got to hang in there a little bit longer in this response. And we're looking forward to better times here if we just hang tough a bit longer. Thank you, Mr. Chairman.
Thank you, Terry. Questions?
Mr. Chair.
Chairman?
Ms. Conwell?
Yes, a couple of quick ones. Through the chair to the director. I missed the number of deaths that you had in Cuyahoga County.
I'll show you that slide. Councilwoman. One more.
And I'm sure we have that presentation. Do we have that, guys? Was that sent to us?
Here, can you see this slide,
Yes.
Councilwoman? Yeah, so 1,920. This is as of yesterday.
Okay, and that's Cuyahoga County.
Yes,
All
ma'am.
right. On your key metrics of racial equity slide that you showed us, do
Okay.
you think the digital divide played any role in why the African-American number was so low?
Absolutely. I think that, if people who clicked first, or even people that pick up the phone to call first in certain circumstances, they were shopping for vaccine all over the place and, across multiple counties. And that deficit was a major issue without question. And, many times people were trying to call in, and that's what we're doing now to try and support people to bridge that divide. Lots and lots of calls are being made, connections to faith communities among people that folks trust in the Black and Brown community to reach out. We also heard folks are reluctant to give their personal information over the phone. We've heard that from lots of people. They'd rather do it in person rather than do it over the phone. So,
Well, that's why the census is low.
so
Right.
that's a challenge. And so, yes, I absolutely agree with you.
Okay, one other thing. I know you said this was running smoothly and this is the soft opening. I did receive a call today. So I guess they still have some glitches in, and hopefully they can work that out before St. Patty's Day in regards to the individuals that register, and they're giving an access code, and then they, when they go down there for their appointment time, one was turned away yesterday because something didn't go right with the access code after they waited a couple hours and all that. Are they working on that?
Yeah,
What's
Councilwoman, they actually
happening?
had that very discussion this morning. So folks think when they get that access code, let's say the number is 2634, that they bring that number they have, and that's what gets them in. The access code is what they use to go through the website to actually get a reservation. And so they're clarifying that for folks, but if they're coming in with that, in that instance, they're helping them to get registered. But they're working that through. That actually got discussed by the incident commander, Brigadier General O'Connor, just this morning, that they're working through that. So they've identified it, and you're right, it has been a barrier, and it's a clarifying piece that our community partners are also helping folks with. But I think they're working to fix that.
Okay, because it would just, an alternate if the person doesn't, and this individual did not have access to a computer, so they had somebody else do it for them. So, maybe you could bring up to them that there are going to be some digitally divided individuals here in this state. Can we just accept an address, a driver's license that states, if they don't have an email to do this, they can bring in and show that they're a resident of the state.
I think they're bearing in mind some of those barriers you say, Councilwoman. I think that they're trying to do everything they can to assure that there's access. The regional administrator from the Federal Emergency Management Agency from FEMA is here and has made it clear that equity is their number one priority. It's been crystal clear in these discussions, and I think they're going to do everything they can to make sure that people can get the access that they need so that everybody gets a fair shot at a vaccine and also at this site. So I'm very encouraged based on what I'm hearing.
Okay, and just one final question, Mr. Chair. In regards to the age groups that you listed, I know different organizations, some are saying 50 and up. You guys are kind of opening up 50 and up. And then as the weeks go on, as it's at the Wolstein Center, they will provide an update of what age group is available.
Yeah, just this morning, Councilwoman, the governor announced that Friday, this coming Friday, that the age range will drop to 40 and above.
Okay.
Age 40 and above, and there will be 5 additional medical conditions that will qualify. And I haven't seen those yet because we've been running around here, but they should be out soon today. And we'll make sure we get those up on our website. And then March 29th, which is just around the corner, I guess, that any adult will have access to vaccine. So Pfizer, you can be 16 or older to get Pfizer, and Moderna and JJ, it's 18 and older. So any adult will have access by the end of the month. That's per the governor this morning.
Okay, because I know there's our Department of Health and Human Services, there's a lot of social workers and things that go into people's homes and they're still not. So I hope that is, they might not qualify by age, but I think that should be definitely listed as one of anybody that's going into somebody else's home should
Mhm.
definitely be added to that list. So if you have someone to share that with, please do that.
I will, Councilwoman, and by March 29th, basically everybody's in and everybody will be eligible. And then we're going to really need to, that is adults, of course, where vaccine is only currently approved for adults, and Pfizer is for those 16 and above, I should say, but Moderna is 18 and above with the Johnson & Johnson. So that means that all these 80 providers, the community pods that we're doing, the community health centers, the hospitals, the work here at Wolstein, all that it's a real opportunity to move Cuyahoga County way ahead, to move us way ahead, our community, and that protect more of us. And I think that also has a lot to do with economic opportunity in so many ways to get us past this. So I think we have to take full advantage of this. Anything you can do on council to help us spread the word among the churches and community agencies to tell folks to take that vaccine, sign up, and it'll get us out of this mess a lot quicker.
Thank you, Director, and thank you, Mr. Chair.
Mr. Tuma.
Thank you.
Mr. Chairman?
Thank you, Mr. Chair. To the director, thanks for being here this afternoon. Appreciate it. I know you got a lot going on. I hear it in the background. So with respect to the vaccines that are currently out there, is there any information as to the efficacy, as how long those are intended to last?
Well, it's an interesting question, Councilman. Well, first I'll start off, you didn't ask this, but I'll start off with actually getting COVID. The current conventional wisdom from the science is that provides at least 3 months of immunity. It could be longer, and I think that's because the science is evolving in real time. Initially, the thought was, right now, if you got vaccinated, the initial guidance says that at least for 3 months, you wouldn't have, if you were exposed to someone who had COVID and you were fully vaccinated, 2 weeks after you've had your second dose, for instance, if it's a Moderna or Pfizer, you would be protected and you would not have to quarantine for 3 months. I think CDC is that will evolve. There's talk that perhaps the immunity will last longer, but they're still looking at that, and it's evolving in real time. So the sense is that it may provide longer immunity than 3 months for those that are vaccinated, and perhaps longer immunity for those that got COVID. But the idea is you should still get vaccinated if you got COVID, because it provides longer lasting immunity and more durable immunity. But we have to continue to watch the science on this and to understand it. We do expect that as these viruses do shift and drift, that we will have to have boosters. And we know right now we get a flu vaccine every year, those that choose to get it, because the flu, the strains that circulate across the world vary every year. And so the flu can have 3 or 4 different strains that are chosen each year based on what's circulating in the Southern Hemisphere. That's the vaccine that's made for the Northern Hemisphere. So this is our new normal. And I think you'd expect to see a COVID vaccine as part of our future vaccine regimen. And I think that makes good sense.
Okay, I appreciate that. The second question I have through the chair is I did notice there was also a disparity between men and women getting the vaccine. Can you account as to why so many more women are getting it as opposed to men? Is there any known reason for that?
I'm not sure if this ties back to the number of well, I talk to guys myself, and some of the guys I talk to generally are more reluctant than,
Yeah.
I mean, I would ask all of you what your thoughts are on that. I do know that, at least in the healthcare realm, there were a large number of women in healthcare. But I just generally talk to more women appear less reticent than guys to get vaccinated. But I'm interested in other theories that you folks may have about that.
Yeah, the only one I was thinking of, maybe the number of teachers who have been vaccinated, maybe perhaps there are more female teachers. I don't know. I'm just throwing that out there. But
Yeah.
I was just curious about that. And and in talking to other guys too, it seems like they're kind of like, oh, I don't need that. I don't need that. So that's something I think we got to kind of watch too, just make sure that, not letting that machismo get to people when they really need
I
it.
agree.
And then my final question is I noticed you indicated that the number of flu cases, influenza went down because of the mask. Do you foresee in the future possibly the use of masks during flu season as maybe a way of countering on a regular, consistent basis? I mean, we see that it works. Maybe that would be a suggested guideline during flu season to where, I mean, I know I'm probably upsetting a lot of people with the mask thing, but if it works, it works.
Yeah, I think it's an interesting point, Councilman, that is not lost on the CDC. We know that in Asia, in many places, masks are pretty commonly worn during flu season, and I think that it does impact the spread of flu. I think that our remote work has impacted. When you're sick, you should stay home, and people still come to work during flu season when they're sick, and they become part of the transmission cycle. I think some of these tried and true interventions may very well be incorporated to try and reduce the burden of flu, because flu affects our ability to be productive. It has economic impacts on our communities and on our schools when kids are out sick. So I think it's something the CDC is going to look at very closely here and as we move through this pandemic.
Okay, I appreciate it. Thank you for your hard work and your comments. Thank you.
Mr. Chairman,
Mr. Miller.
thank you. A couple of questions. First, I was not clear on the answer you gave about Councilwoman Conwell's question about the access code. What is the problem with how people were bringing the access code, and what has to be done about it?
All right. So specifically, if you were to go to the state website, the Get the Shot website, you'll see that you fill out some basic information about your age and about whether you're in a specific group. And then there's actually a box on that website that says access code. And so the idea is that if you go in to that website, you put in the access code that you have, and that access code then allows you to proceed for an appointment. It makes sure that you can get access to an appointment. So what's happening is some people may get that access code and they receive a number, for instance, if it's a number, and they put it in, or they just bring it with them. They don't go into the website to do the registration. So there are a number of agencies like 211, a range of community agencies, churches, nonprofits, Global Cleveland, a range of agencies are helping people to sign up with those access codes so that they can ensure that they get their appointment time. It's important that they get an appointment time so that they can gauge volume here at sites just like we do at our clinics, and they can understand what the throughput would be and accommodate that so that there aren't long waits for everyone. So that's the challenge that they're working through now, to assure that people understand that access code has to be put into the website in order to generate an appointment, and then they get to choose their time. You click on a time, and then you'll get an email back that will tell you what time to come.
And do you recommend that Get the Shot website for people who have access online is the best way to set up an appointment, or are there other ways that are better?
Well, if you're trying to get here at Wolstein, there are also a lot of other sites that are on that website, and more agencies are coming on board to link through there. I think you can go through that site, and we're moving toward sort of a combined place where people can look for vaccine. But I think checking around and making some calls is not a bad idea. Also, if you can't get access, but what I'm finding is that more and more people are finding access. More and people are able to get a location and a site. And if you check with your, particularly for as Councilwoman Cowell said, if we're talking about communities of color, a lot of the churches and nonprofits in the community are reaching out and are really reaching out a lot to try to get people help in signing up. And 211's been a tremendous resource in assisting folks as well. And as more vaccine is available on the street, we're going to see that gap in access beginning to diminish for everyone. We can expect by the end of March, a lot more vaccine on the street, and by the end of April, significantly more. And also we'll see a lot more Johnson & Johnson available, which is of course is one shot, and that is very attractive to a number of people. I know people I work with that don't much like needles. Not that anybody particularly likes needles, but some people don't like them at all, and they're willing to take that one shot rather than two.
Okay, thank you, Mr. Chairman.
Other questions?
Mr. Chair,
Yes.
Sunny. It's not a question, thank you. Just at the end, I want to just thank the director, Alan, for your work. I'm very proud that you've been at the helm of our health department during this, and you know, it's just amazing what your team has done. So I just want to say thank you.
Thank you very much, Councilwoman Simon. I appreciate that. I've never been prouder to be in public health than I have been through the ups and downs of this thing, but we avoided the worst. The hospitals never were, we didn't have a major surge where the hospitals were inundated. They never had to open up alternate care sites, and we avoided the worst. I think this was an incredible team effort, and that I'll always carry with me. So thank you for those kind words.
Chair, if I may ask a question.
Yes, ma'am. Yes, ma'am.
Okay, it's been quite a journey, Director Allen, and I really do appreciate all your hard work, and so glad to see the Wolstein Center set up. I think a mass distribution site was needed, and that in coordination with our local sites is just a winning ticket. So thank you for all that you've done in coordinating with the state of Ohio and getting the Wolstein Center on track. Not long ago, we had a meeting with UH and Cleveland Clinic, and at that time, it was all about demand and not enough supply. And we were doing the best we could in treating those that we were able to, and many people were frustrated at that time trying to get in to get their vaccination. It's starting to flip, as you said, and we are looking at more vaccination. And I wondered, where are we? I remember asking the question, are we prepared? So if we get to a point where it sounds like at the end of March we will be there, are we prepared to address everyone who comes in and wants a vaccination? Will there be still long waiting lists? Do we have the personnel in place? I know Wolstein Center is doing 6,000 a day, I believe is their capacity. Cleveland Clinic said at the time they could do 7,000 a day. So where are we, first of all, in that environment of being able to deliver now that we have the vaccine, at least in the near future, widely available?
Thank you for your question, Councilwoman Baker, and thank you for your kind words. So I think I've talked to providers in hospitals routinely. We at the health department are increasing and have a plan to increase the number of large pods that we're going to be holding, as well as complementing those with a range of community sites where people can get access. So we cross that digital divide that was mentioned earlier. We know that the pharmacies have the capacity to ramp up and receive more vaccine across these 80 providers. The community health centers are continuing their pop-up locations. I think we have the ability in a community as big as ours with 80 providers to accept and disseminate vaccine and ramp up significantly. As you say, the hospitals are prepared to do that as well. So I feel like what we'll see is our waiting list. They're mining right now. That long waiting list we've had is being mined to support work here at the Wolstein. So that list will go down. And so I think you're going to see across this community a lot of capacity to ramp up that I feel is in place, and people are prepared to do that if they have more vaccine. Particularly, we talked about the pharmacy, we talked about the hospitals, and we're going to be adding those extra pods ourselves. I do think, it's important that all of us have a responsibility to explain the importance of people getting vaccinated, not just, a decision about them, it's about their family members and friends and coworkers. protecting all of them. Because, you know, we're a little bit concerned about whether in a month and a half that supply may eclipse demand. And that's going to be up to us to make sure that we help to say that it's not time to stop, because, you know, you're not seeing many people get sick on, you don't hear about it on television as much anymore. And that's a real concern that we have. In H1N1, we saw that demand dropped in 2009 and 10. And so I think we need to learn from that lesson and continue to focus on education and the importance of vaccination. And that's what we intend to do, Councilwoman.
Okay, that's really good to hear. And I know that that's always been the goal, to meet the demand, especially when the demand exceeded the supply. I mean, it's unbelievable that we now have and will be seeing more supply, and we're trying to reach out to those that perhaps are not as eager and do need to be told that this is important. The outreach campaign that you referred to, there was a study done, and I've been reading this and keeping up with it, the Israeli study that said that the asymptomatic infections are not transferable. They're not contagious. There's a 94% chance that if you have both shots of vaccine through Pfizer and you've waited the 12 days after your last shot, that it is virtually impossible. I mean, single digit possibility that you can give it to someone else without having to wear a mask or distance or any of that. That would be a huge outreach to reach those that are still skeptical or feel that their life really didn't change that much. After they get a vaccine, they're still told to distance and wear a mask. Is there anything that you support in that asymptomatic Israeli study that we can use in our outreach campaign to try and get those that have not yet gotten their vaccine to make that step forward?
Well, I think the, you know, we have, I think here in Cuyahoga County, we've had a lot more interest in vaccination than many places. I'm on the phone once a week with the governor and all the health departments every Monday at 7 o'clock in the morning. And we talk through the issues, and places downstate and around Ohio, they're seeing lower uptake. And they've actually said some Cuyahoga County residents have driven, you know, an hour and a half to go get a vaccine when vaccine was scarce. So we have still pretty robust demand here that I think will be higher than most places. I think that, you know, from the science end, CDC is working hard to try and, you know, basically review and assess all the data that's coming in from multiple studies. And I think that the pace of the science is frenetic relative to this virus. It's happening so quickly. Understanding, you know, the impact of asymptomatic transmission relative to the burden of disease and spread is a huge issue. I think for me, we just need to explain that there's a certain percentage of us that we want to see get vaccinated. It's been said, you know, 70 to 80% of us need to be vaccinated to get the herd immunity that we all understand the idea that enough of us are protected so that all of us are protected. And that is a concept that's associated with a range of diseases like measles, like mumps, like a range of issues that are vaccine preventable that used to be around all over the place. So I think that's going to be a challenge that we're going to be facing, and whatever we can do to encourage that level of vaccination across all sectors, whether in sectors of employment. And I think that you know, in some hospital systems, flu vaccination is mandatory. There's been no talk of mandating this vaccine anywhere, and I understand that it's just been out, but I think we should be encouraging. Doing everything we can to encourage that we keep pushing to use this life-saving resource. And I think that's going to take all of us to get there, frankly.
Yeah, I guess my point is the asymptomatic spread of infection. That was a huge concern, that even though you may not have symptoms, you don't show symptoms, you don't even know you have it, you're still someone who can give it to others. And having this overcome by taking the vaccine just seems to be a game changer.
Absolutely. Absolutely. I completely agree. And I do think the other piece is around masks, is the value of masks that it really was not well understood. It's been incredibly effective as well.
Yeah,
Thank you.
well, I think you can probably get more people vaccinated if we can tell them a mask is no longer needed. But that's, let's hear. The second question I had was the CDC recently also came out with a 3-foot versus 6-foot distancing. Do you have a comment on that?
Well, I know that the state is looking at that guidance, that we know in certain circumstances, particularly in school environments, they have some challenges if they're using barriers, they're using, they're masking, and they're looking at classroom sizes and cleaning. In certain instances, you may not be able to attain that 6-foot distance. That's certainly ideal. And we think it makes sense if you can attain that to do it. We've been consulting with schools since the very beginning of this pandemic around how they're approaching this within the school systems. We are seeing new guidance around quarantine and isolation relative to schools that just emerged from the state health department that is taking into account the science relative to spread and all that. Again, the data is helping to drive the decisions. I would say that 6 foot is ideal, and in certain circumstances, 3 feet may be all that they can attain in that setting. And so we're going to continue to work with schools. We supported the March 1st goal of the governor to get kids back either hybrid or full face-to-face. And we're there with schools once a week to continue to work through that if that's one environment where this becomes very relevant, of course.
Okay, so your opinion then on the 3-foot versus 6-foot is only in a school environment. You wouldn't recommend that for our restaurants or other facilities that are restricted to trying to work within the 6 feet?
I think right now, that may change based on what our public health advisory system tells us, and guidance from CDC can evolve. But I think right now that's state guidance, and I think people gather in large groups. And I actually saw and was involved in dealing with outbreak responses where lots of people in restaurants were exposed, groups of people were exposed. And so, that'd be my concern, whether it's through a server or through friends from different households sitting down at a table. That's one piece, but then also relative to their distance to others and how they may interact. I think that science is still something we need to understand, and CDC would accordingly, in the state then accordingly would alter their guidance. And so we'll keep an eye on that and see if it changes. But I think it still, sits where it does at the moment.
All right. And lastly, Chair, if I may, you mentioned earlier that the virus, if you've had it, you're immune for, say, up to 3 months. And if you've had your first shot, I heard that you could have perhaps immunity up to 60, 70, 80%. And then, of course, with the nice weather, people getting out more than they have. That combination of positive forward movement, and especially, of course, with the vaccination being more accessible, that 50 per 100,000, is that a doable number that we can see in the foreseen future that the governor is putting out there? Is that like a month away, 60 days away? In your, opinion, I know that it is just an opinion, but in your medical opinion, what does that mean for us, 50 per 100,000 people in order of time?
Yeah, well, that of course is very difficult to pinpoint. What I do know is that number will be a direct function of how many people get vaccinated and how quickly they get vaccinated in this county. The fact that we have the only federal site that's running 6,000 a day, mostly being taken advantage of by Cuyahoga County residents. Of course, it's a federal asset, so they do take people outside of Cuyahoga, but mostly our folks are the ones that are gaining access. Combined with the other 80 locations and more vaccine on the street is going to get us there quicker, which will be a direct function of where we end up relative to the advisory system. I think we'll know Thursday as to the next, how we've progressed relative to that level, which is currently 190 per 100,000. I expect that number to go down. It has gone down from over 200 just a week ago. And so it will continue to drop. I do think it has everything to do with how many people get vaccinated at a very basic level. And our total immunity is a function of who's exposed and who's vaccinated. That is how we really look at our level of immunity in the community overall. So I think, Do I think it's going to change in the next 2-3 weeks? I don't think so. I think it might be a bit longer, and we'll have to watch how that progresses. It will vary significantly county by county with 88 counties in the state. But I still think we're a bit away from getting there. And our job one is shots in arms, and that's what we're focused on right now, to try and get us there as quick as we can. But I can't say for sure because I don't think anybody really knows that answer right now.
I'm optimistic. I think we're going to get there, and I think it'll be sooner than perhaps all of us think.
I hope so. I hope so.
Yeah. Well, thank you again for your work. I don't want to keep you any longer. Appreciate all that you've done and look forward to these cases continuing to drop, everyone getting their lives back. Thank you.
Any further questions?
Mr. Chair, I just had one quick question.
Yes, ma'am.
Okay, through the chair to Mr. Allen. On the website, does it list the different effectiveness and the different vaccines that are available out there?
Well, we have some information on our website about the different vaccines. We know that the Pfizer, Moderna vaccines, if you get 2 doses, are 94 or 95% effective respectively, which is pretty amazing effectiveness. First dose, it's been thought about, 50 or so percent protected. Johnson & Johnson is somewhere in the 66 to 70% effectiveness with that 1 dose. But I believe we have a lot of information on our website. If you have any questions, Councilwoman, I'm happy to provide you some links for the public access. But these vaccines, give you a sense of things. The flu vaccine is normally 40 to 60% effective any given year. All these vaccines are more effective than that. And that's the real message here is that the effectiveness of these vaccines is above what anybody expected, and that's nothing but good news.
Yes, I have heard that, no matter which vaccine that you have access to, you should take advantage of it. I'm just was very concerned about the 1 dose because it is a little less effectiveness. And I have City of Cleveland that'll be on to present, I think on March 31st on my committee in regards to that. I just wanted to make sure if you could send me the links, that'd be appreciated so I can get that information out there.
Will do.
I think will feel a lot easier if they're a little bit more informed about, and they're not going to always go searching on our websites. You know what I'm saying?
Will do, Councilwoman.
Mr. Chair.
Mr. Jones.
Terry, I just wanted to be clear. When you say the 2-dose, the Moderna and Pfizer are like 90% effective, is that effective in making sure that no virus enters the body? And is that what it means when you say 90% effective?
Well, so both those, if you get both doses, Councilman, it means that it reduces your risk by about 95, 94%. Certainly you could get it, but it significantly reduces the risk. And that's the key. And I can't recall many vaccines that are that effective. Very few have that level of effectiveness. That's about as good as it gets. And we're already seeing the impact of that. We saw it when we started with nursing homes. Our death rates have been dropping substantially. Our hospitalizations have been dropping. And that is clear evidence that this vaccine is doing its job.
Right. I got a call from Charity Hospital, and they actually told me that all 3 vaccines were 100% effective at reducing the hospitalization and the deaths. Is that a fair statement?
That is a fair statement, Councilman. I think you make a very important point that these vaccines are incredibly effective at reducing hospitalizations and fatalities. And so, people get the flu, most of us can ride it out at home. And if we have vaccines that are preventing the worst, all these do just what you said. That's exactly, those are the facts with all 3 vaccines.
I appreciate it. Thank you.
Anything further? Anyone else? Well, Terry, I appreciate you being here. Appreciate your time. Actually, I saw an interview with Dr. Fauci last night, and he's now down to 3 feet as opposed to 6 feet. Although my cynical mind went, so I wonder if he has stock in those stickers for 6 foot on the floor. Now they have to buy 3 foot on the floor. So, but this has been obviously we've never been through anything like this. Many of us, anyhow. Some of us went through the polio scare, but but this one has been quite interesting, and I know mistakes have been made, will be made. We don't, we have to move, change as we fly. I know it's been difficult for you in particular, your group, having to deal with some information from the state that might not have been as easy to implement, but you did the best you could. And I really appreciate all the work that you and your team have done. So if you would express that appreciation to your team, I'd appreciate that.
Will
And
do. Thank you.
Thank you for your time. And we'll see you soon for a further update.
Very good. Thank you very much. Thank you, everyone.
Thank you. Do we still have, I saw the sheriff might have been online. Is he still there?
Yes, sir, I'm here.
Oh, hey, Sheriff Island, welcome. Your first safety meeting. Glad you could attend. How are things going? I know you started on a rough note with the passing of the CO. How you been?
Everybody here has been extraordinarily welcoming. I am fitting into everything as quickly as I can. It is unfortunate that first weekend in that we have this tragedy, but we are dealing with it the best that we can and supporting all the people over here the best that we can. But thank you very much for asking.
Well, again, we wish you the best of luck. And if there's anything that you need, just please let any of us know.
Absolutely. Thank you, sir.
Okay. Is there anything else from the committee or any of our
Mr.
guests?
Chair,
Yes,
I think the sheriff, is he still on there? Chief Violin, just a quick question. Do you know anything in related to the vaccines being available for the inmates?
Right now, we are scheduling for corrections officers. We have through Metro Health been handling that. We have not yet got to inmates. I can get you an update as soon as I'm aware of that.
All right, but it's on your radar, correct?
Yes, ma'am.
Okay, thank you. Thank you, Mr. Chair.
Okay. Anything further from anyone? Is there any miscellaneous business? I would be remiss if I didn't mention over the weekend, the Mighty Eagles of St. Edward once again won the state title in wrestling, and our brothers down on Lorraine Avenue, the St. Ignatius Wildcats, are in the Final Four of the basketball tournament. So us Eagles are supporting our Wildcats and anybody else from Greater Cleveland, and good luck Wildcats down in Columbus. With nothing else, we're adjourned.